Hi, this is Dr. Bhargava. I have a few interesting cases to share with you in this short video. Our first patient was recently diagnosed with cervical cancer and they underwent a MRI of the pelvis for local staging. So these are the images from their pelvic MRI showing the tumor confined to the cervix on the sagittal T2 axial and coronal T2 weighted images. This is their uterus and the vagina has been distended with contrast. There is restricted diffusion seen here as high signal on DWI and low signal on ADC images. This patient also underwent a whole body FDG PET-CT study for staging, and these are the images. On the rotating image, we find focal hypermetabolism in this large cervical tumor behind the urinary bladder and two foci of increased uptake in their abdomen. Now, these two foci corresponded to retroperitoneal para-aortic lymph nodes and are consistent with metastatic disease. So this patient's cervical cancer was upstaged with FDG PET-CT study. This is a review article on using FDG PET and MRI together in gynecologic malignancies. The authors provide a brief technical overview of PET MRI, highlight how simultaneously performed PET MRI can improve standalone MRI and PET CT in gynecologic malignancies, and provide an image-rich review to illustrate practical and clinically relevant applications of this imaging technique and review common pitfalls encountered in clinical practice. Our next patient is a companion case. This is a young female who also underwent a FDG PET-CT study, and on the rotating image we see a focus of mild FDG uptake in the pelvis corresponding to the endometrium. And so here we see that the shape of the uterine cavity is highlighted by this endometrial uptake. And we find that on the sagittal image, here's the uptake in the endometrium, and it corresponds very well to the endometrium seen on the contrast enhanced CT that this patient had, also on this sagittal image in the retroverted uterus. And so remember that endometrial uptake in young patients can be physiologic and should not raise a suspicion of malignancy. If this was a postmenopausal woman, this endometrium would qualify as thickened endometrium, and focal FDG uptake in that situation would definitely be abnormal, needing further evaluation. Here is an article on the topic where the authors conclude that in premenopausal patients, normal endometrial uptake of FDG changes cyclically, increasing during the ovulatory and menstrual phases. Increased uptake in the endometrium adjacent to a cervical tumor does not necessarily reflect endometrial tumor invasion. Increased ovarian uptake in postmenopausal patients is associated with malignancy, whereas increased uptake may be functional in premenopausal patients. This is our next patient, and we were evaluating a lung nodule using FDG PET-CT in this study. The lung nodule wasn't FDG avid, but we see linear symmetric uptake in the neck and also in the chest. So take a look at these linear foci of uptake. Their left ventricle is dilated, and there is increased uptake in the left ventricular myocardium as well. And these fused images are showing uptake in the sternocleidomastoid and scalene muscles, trapezius and pectoral muscles, and also posterior intercostal muscles, and uptake in the diaphragm. And so what we are seeing here is increased FDG activity in the accessory muscles of respiration, which include the scalene, sternocleidomastoid, pectoralis, trapezius, and external intercostal muscles. And so the question is, what's causing this? So this patient was short of breath from their emphysema and chronic obstructive pulmonary disease, and the dyspnea was causing them to recruit the accessory muscles of respiration. These are two images from their CT of the chest showing severe emphysematous changes in both lungs. And this is an article related to this topic, where authors say that FDG PET-CT of the respiratory muscles may have a potential in characterization of COPD. This is our last patient. Here we are looking at two images of the brain, axial image and coronal image, and these were acquired using FDG in a patient with complex partial epilepsy, looking at uptake in the temporal lobes, and definitely there is focal decreased uptake in the left temporal lobe, consistent with seizure focus arising from the left temporal lobe in this patient's interictal FDG PET-CT study. And this is a good review article on the topic, and the authors summarize that optimized interictal PET-CT and ictal perfusion SPECT as part of a multimodality imaging platform will be important tools to better understand the neurobiology of epilepsy and to better define the epileptogenic focus, ictal onset, functional deficit, and surround inhibition zones in refractory partial epilepsy. Thank you for watching.